So I want to thank our panelists for being here. Really appreciate it. And there are so many with expertise in the room. I recognize many of you. And we were able to pick some really fabulous representatives of our community here. And we have their bios on the program. I'm not going to read them all in the interest of time because you have written many questions here and we'd like to get into the dialogue. But I ask you to please refer to the bios so you have a sense of what the richness of what our presenters have to offer. And also you can find them. So please refer to their bios and the wonderful agencies they are representing. So I'm going to just randomly, in the order in which they were received, read the questions that you, the audience, are asking of the panelists and ask you to just jump in and speak freely and also honor the time as best as possible.
How much time do we have?
We have until about 12:15.
Okay.
So, the first question is and I just want to say in terms of background that we did a survey of local practitioners through the work we've been doing with Santa Barbara Foundation grant in the Caregiver initiative, which is just such a fabulous initiative for our community. And the survey of practitioners helped us understand how we wanted to put together this conference and really finding Barry and Julie. And one of the key things that practitioners wanted to know, what are the local resources, and which is why we have here local representative. So the first question, is there any local resource for caregivers to get together and take better care of ourselves? Kendra.
Hi, I'm Kendra from the Coast Caregiver Resource Center. There are actually a lot of resources in this community, and just as a contrast, I recently, about a year ago, moved down from the Santa Cruz area where I've been working with caregivers since about 2001. Santa Barbara County has a lot of resources for caregivers. So there are many support groups out there, and our organization could certainly give you information about that. I know hospice has a lot of support groups. Family Service Agency has support groups and counseling services. There are many educational opportunities as well, and I think that sometimes an educational opportunity draws a different kind of audience than a support group, but it's supportive in nature, so it ends up being supportive and then a good peer networking opportunity for caregivers. So, I could give you specific resources for specific support groups in the area. We have one up in Santa Maria once a month. It's a self-care support group. So the whole purpose of that support group is around self-care. And we're also going to be developing some other caregiver retreats and workshops to address self-care as a caregiver.
And Kendra, you are the executive director of the Coastal Caregiver Resource Center, just so people know.
So I'm a visiting nurse in hospice care. I'm actually Arlene's deputy chat, and I just wanted to say, if you hadn't seen this or grabbed this, there's a caregiver resource guide out on the literature table, and it is chock full of local resources in a wide range of things, not just caregiver support, which is really important, but the information to help you do some of the planning. And also, if you're a millennial or just a techie or you just can't get out of the house, there's a whole list of online caregiving support as well, which is an option if respite is too hard to get out of the. So please make sure that you pick one up. And yes, we do offer caregiver support, and it's really important from working with hospice, is not only anticipatory grief and dealing with what you know is coming. And I would just say that the sad thing about the marathon analogy is the finish line in my world is you lose your loved one. So it's not always a run you want to joyfully go through. But getting support during and particularly after, and our agency and Hospice of Santa Barbara, who's also here, we offer free counseling and support, anticipatory grief and death, post-death, and that's really important as caregivers to to sustain yourself after you've had a loss so you can go forward and do it the next time.
I just wanted to remind everybody also that fortunately Santa Barbara County has a lot of financial resources for you as well as caregivers. I know that the Alzheimer's Association has respite grants. I believe you guys offer caregivers as so to get support in that way too, physical support where you can actually get away and self-care. There is financial assistance for you to do that.
Okay, thank you. So it seems that you as a caregiver have to give yourself permission to have your own life, yes. What can I do to get to that place sooner?
Not that I have the easy answer to that question. However, I do think just having known so many caregivers over the years, that's a small incremental choice that you can make at any point of any day. And it's usually when we say self-care to caregivers, it sounds like, oh, I need to go out and do something. But maybe that something is I'm reading a chapter in a book because I've always enjoyed reading and that's my time. It's writing a page in a journal. It's going for a walk around the block. It's calling that friend who lives across the country who you don't generally have time to connect with. We use a wonderful tool called a care map. And in that care map, you draw what your support system looks like. And part of that support system could be your pet. It could be the neighbor. And all of those things, those relationships, those activities that you enjoy, whether it's for 5 minutes or for 5 hours, that's self-care. And I think, what I would encourage people to do is put the intention around that time. I'm going to be reading a page in a book because this is how I care for myself. And so it's kind of reframing what you're doing and why you're doing it, I think can be helpful in that effort.
Yeah, we've found both with family caregivers and professionals the idea of taking small steps. So it might not seem, as Kendra just said, it's not looking for large, major breakthroughs. It's taking a small step. As a lot of very busy nurses, we just suggest you can just drive a different way to work. That's a little less stressful. Really tiny little things. But then you're building choice. You're building quality back into your life. And then it feels good when you do that, so you tend to do more of it. And then that's how you get there quicker as far as looking after yourself.
And this is Simon Fox, Executive Director, Adventures in Caregiving. Thank you.
Okay, just a couple of things that in my private practice where I see a lot of both the individual who is going through either the illness or dementia and or the caregiver. A couple of things that we use, certain tools. I mean, a lot of this is about reframing the experience and reframing how somebody looks at this experience. So, you're going from, a lot of people feel that doing something for themselves is selfish. So we talk about reframing that as taking care of self. Sometimes it's just the way people are habitually thinking about something that sometimes we just have to tweak a little bit. Or that old oxygen analogy that if you're in a plane and they tell you to put on your oxygen first so you could take care of your child or someone else, using that kind of analogy that people can relate to, that we can't take care of the other until we take care of self. And the other thing, when some people are really sort of stubborn or scared or fearful of taking on that role, sometimes it's saying to them, taking care of yourself is really doing it for the other, because that feeds into that caregiving mentality that everything has to be done for the other. So if you talk to them about when you take care of you, it's really, or that they say actually to the person they're taking care of, what I'm doing now is for you, as opposed to, sometimes the reframing of some of these experiences help. So that's the kind of thing that might be helpful.
I just wanted to also address the idea of the people out in the field who are also professional caregivers, because that's, we're talking family caregiving, but I think professional caregivers also need to make sure that they build that into their day. And I kind of always ask people that are in these situations, how well do you receive? I know you're great at giving. How well do you receive? And is there a way that you could open and say yes when someone offers, when someone says, hey, I'm willing to sit with your dad so you can take that time, that walk around the block. And I would just say that in our agency, we've had a grant through the Bauer Foundation teaching compassionate culture, and we've been teaching our staff simple mindfulness practices, like a 3-center check-in. I mean, it takes 1 minute to realign yourself with what is my body feeling, what is my mind racing, what's in my heart. 90 seconds of self-awareness is the way that I can refill my cup so I can go on to the next thing. So professional or private or family caregiver, I would ask yourself, open up to receiving more. There's lots of people that want to give if we would allow ourselves, all of us, patients and the family as well. Thanks.
Thank you. This comes to actually another question that came from the group here about how meditation and the practice of mindfulness can help caregivers in their day-to-day challenges, and maybe you also have additional suggestions for helping people center themselves. So I'll just throw that out.
Well, I just wanted to offer you, a while ago, Hospice of Santa Barbara brought in Frank Ostaseski, and many of you may have heard of him. He was the founder of the Zen Hospice Center. And he has a book out called The 5 Invitations, and it's 5 simple approach, not simple, but seemingly simple things like bringing your whole self to the experience, and a whole approach to being with oneself as I'm being with the person I'm caring for. And simple practices like, I'll just give you one example. Crossing the threshold into a room, like I might be with an awareness, which foot am I putting in? It like brings me in. Oh, I'm entering this room from a sacred space with my right foot. In that 10 seconds, I bring a different energy in instead of just rushing in. So I know Simon has a lot on this, but I think mindfulness and meditation is a really, for me personally, a very key component of my ability to sustain myself in the work. It's called the 5 Invitations. It's just one of many. There's lots of rich sources, and we have a wide community of mindfulness practices in this community. There's lots of free mindfulness groups around. I know Adult Ed is offering stuff in the fall, so talk to me afterwards. There's a lot around. But to me personally, in the medical world, that's proven to be a good source for caregivers and for professionals too.
Yeah, I would second that, and say the method is actually secondary. We tend to focus on which method is the best practice. It's the one that's most meaningful to you that will be the one that you stick with. Because, I mean, it's not just doing mindfulness once or twice. It needs to become a practice that it becomes part of your life. And the only way that happens is if it's meaningful to your life. So it may be mindfulness, it may be contemplative prayer, it may be yoga, it may be a variety of different things, or your own personal special mixture of these things. And that's what keeps you going. And I can speak from experience on that because I've been practicing this stuff for about 40 years. So, and every day I'm making a new discovery. So it's not, quote, a discipline. I love this stuff, and I keep going and keep discovering, and that renews me. And then I make better decisions. And so whatever your faith is or your philosophy, your particular angle, find something that intrigues you, something that welcomes you in, that you want to keep going with. And if you're not making new discoveries, if it's not opening up, then make some adjustments. But yes, set some time aside. And I think that's the other thing I wanted to say is having a special time and place for you to sit undisturbed, to do whatever it is, contemplative prayer, journal writing, mindfulness meditation, stretching, but it's just you with yourself, and you've got, whether it's 10 minutes or 2 hours or whatever, but having a little place and a little time that is sacred, set aside. And that, because what happens is then even on those really rough days, just the very act of going and sitting in that place will start to bring you back to center. So that is absolutely crucial if you can do that. So.
If I can just make a comment, because, I'm listening and I hear what people say to me when they hear this is something I should really do for myself, and you're talking about caregivers who have this much time and they become overwhelmed, or they're so anxious and they say, I don't have time for that, or I don't know how to do that, or I can't quiet my mind. So being the New York practical person I am, what I have said to people is I have them just in my office use an app on their phone. And we do a 5-minute meditation, which is accessible to them at any time. They don't have to look for classes. They don't have to set a special time aside. So there's a lot of apps on the phone. One I use in my office is one called Simply Being. And so I give them the experience, 5 minutes. It's just 5 minutes. And they actually can get a sense of what that feels like in the room, in the moment, something that if they could do it for 5 minutes with me, they could possibly do it somewhere else. So I like to give people not just that big picture, which overwhelms caregivers oftentimes, but something really small, but gives them that invitation and the opening and a real way that they could possibly integrate it into their lives.
I didn't introduce myself before. I'm Marcy from the Alzheimer's Association. And coming from an art background, I always find now that these adult coloring books, just sitting them down somewhere, as Simon said, to a quiet place, it could be as simple as that, because mindfulness sometimes is such an abstract word, especially for caregivers that maybe aren't from the mindful generation. So just using one of those adult coloring books now where you just kind of pencil in is a great way to just center as well.
And I just want to add to that, that's such a great point, Marcy, about the label mindfulness. It's really anything that gets us into a state of flow and slows our breath and our pace and centers us. And I think that's really a lot of the help we can give to caregivers is about coming back to the self and permission to do that. So thank you for bringing that together. So our next question is, what about the caregiver of a dysfunctional parent and a dysfunctional family system background, which I have not met too many functional families. Therefore, is there such a thing? There's high resentment and low finance and low family support. Yeah, so that's really a convergence of a lot of challenges. So how do we support that situation?
Just coming from the association, the Alzheimer's Association, we have a lot of information and tools that we can give you, online tools or coming in and just receiving some of the other handouts that we have that can actually help you with this. For me, and that's a hard question to answer in 1 5-minute seating because there are so many different ways to tackle it. But I believe that the majority of it is fixable. It's just a matter of finding the resource that can help you get there. And I know that we definitely have tools, and I've seen a lot of great results from the tools as an association that we offer. So you can feel free to contact the Alzheimer's Association if you need more information on that.
Just to echo that, the Coast Caregiver Resource Center also has a very robust counseling program. So we've got an in-house therapist who provides telephone counseling, which has become especially popular with caregivers who can't get out of the house and get to an appointment. And that's been really effective for our caregivers. And I know we've got openings right now with that therapist. And then we've also contracted with counselors both in Ventura County and in San Luis Obispo County. We cover that tri-county area. So getting some counseling support, getting to a support group. As it's been mentioned, there's a lot of books out there. And it's really kind of an individual question you want to ask yourself is, okay, I am, finding myself in a situation that feels dysfunctional for whatever reason. What is it that I need in order to move forward, as opposed to, looking at, I meet a lot of caregivers who think, well, if my brother would just do this, or if my, cousin would just do this, or the person who calls from across the country, sometimes I'm that person, calls and says, hey, this would be really a good idea to do. Really, instead of kind of looking outward and thinking what outside of you needs to change, think about what you might need in order to feel best supported, and then access those resources either through the Alzheimer's Association or Coast Caregiver Resource Center or Family Service Agency.
I would just say sometimes when you're in dysfunctional situations, it really helps just to be around somebody who's sane. And because you almost get used to it, and everybody's being highly manipulative, and the victim, persecutor, rescuer thing, and all that stuff. And sometimes you just need to walk away and not play that game and connect with somebody who reminds you of a wiser approach to life. And came across a great book, and I'm forgetting the author, but it's called Change or Die. Right, and there's really three things that you need when your back is against the wall. And that's pretty much where you are, where you either change or you die. There's three real things, and it's the people, the practices, and the perspectives in your life. And you can build all of those in. You can build healthier people into your life. You can build healthier practices into your life, and that tends to give you a healthier perspective. And so building that in is crucial, because then you're going to make better decisions and things will evolve from there. One thing I tell professional caregivers is that burned out caregivers are not a source of comfort to anybody, and they make lousy decisions. So if you want to bring your A game to your caregiving, is that you need to be looking after yourself, about looking after your own physical and mental health. And it's crucial. It really is.
I just have a one-liner that was taught to me that has helped me in many things, and it is how I relate to the issue is the issue. So if I'm going to look at, here's my crazy brother, and I perpetuate that negative thing, and here it is again, then I'm put myself on that hamster wheel. And I have a choice in perspective. I'm not saying it's easy, but I have learned that, as you so well said, I can't change or fix anybody else. Boy, I wish I could. Life would be a whole lot easier if I could get everybody to do what I wanted them to, right? Life would be easy. But what I can do is change myself, and in the moment it might be changing my attitude, my perspective. If I have a little bit of compassion for the behavior, if I try to look at it from I wonder why they're doing this, or getting off the familial dynamics. I remember a long time ago saying, just because my mom plays the chord doesn't mean I have to do the dance. I just can hear the music and sit still. I had to do that. She was still playing the chords, so.
I just want to acknowledge that people come into these experiences, to dying, to end of life, to caregiving, with a really deep, there's often a lot of dysfunction, deep dysfunction in the system. And I think, I guess one of the things, and lack of resources are real, lack of finances are real. They affect decisions that get to be made, because they really are. And these are real things. So I guess what I want to say about it is that there is dysfunction, and that I think part of it is to debunk the myth that all dysfunction goes away, or that our expectation should be that dysfunction has to go away. We just have to learn how to deal with it and be with it, understand it. But I guess to take the pressure off, because we sometimes fantasize what end of life should look like, is supposed to look like. It doesn't always look like that. We can do the best we can, but I think we need to be careful about thinking we can erase all of that history and dysfunction. I agree with you, we can each be responsible for our piece that we can work on, but we can't be responsible for every family member's dysfunction or be caught up in trying to fix that. So I just want to add that.
And I would just tag on that whatever families have done in normal times, when a crisis shows up or a family member's dying, it's going to get exacerbated in my experience. So whatever dysfunction has been there, it gets magnified. So put on your seatbelt.
One other little cute antidote, because I think it was very profound. When my father-in-law was dying, you know, the siblings, I was very involved in his care, and my mother-in-law was really rather domineering, and she could be tough on him, and you know, and we thought, okay, we really have to disrupt that system because we didn't like the way that it looked like. So we talked to her, and we talked to her and said, you know, can you be just a little sweeter, a little kinder, just be a little nicer to him? And so she said, okay, I'll try. And so one day he calls me, he says, come here, come in my room. And so I go in there, and he said, what did you do with my wife? He said, I like the old one a whole lot better. You know, and it was such a wonderful moment for all of us to let them be, you know, let them be with their relationship, no matter how we thought we perceived it as dysfunctional. It was their functionality, and we interfering with it was a mistake. So just a little antidote about that.
It's a great story, and it goes back to Barry. I think what you were saying about you know, our tendency as practitioners to sort of jump in and try to fix it and solve it and make everything nice, and it's really about our need to control a lot of the time. And actually, this dysfunction has been happening their whole lives, and it's what they used to, or it's not to them, right? It's our perspective as outsiders, which is the most limited, most ignorant perspective, actually. So that's great. Thank you. Next question. Are we prepared as therapists to recognize elder abuse situations in caregiving?
Just to jump in, this is actually something that's really vital to me. I'm not a therapist, I'm a social worker, but I'm highly committed, and actually hold all of my staff to be highly committed to recognizing signs of abuse and neglect. And a lot of times it's not due to maliciousness so much on someone's part as it is due to burnout, or it's due to lack of knowledge or lack of understanding or lack of support. And so generally I've noticed when I bring in other agencies like Adult Protective Services, it actually creates more of a safety net for that situation. And it's, I don't do that or encourage my staff to do that as a way to get people into trouble, but really let's bring in the support, let's widen the services, let's make the platform stronger that this family is trying to stand on to get through this difficult situation. But yeah, I do hold that as a high value in my profession, for sure.
I would say, depending on what agency, I'm not a therapist either, but we certainly train all of our staff and our volunteers as kind of mandated reporters for all aspects of abuse. And I just want to put a word in for the abuse that people forget the most, but I think we hear a lot of, is financial elder abuse, which is kind of more hidden, or one that is sometimes harder to detect. And so, yeah, I think we have to look at all the dynamics going on. And I don't, you know, if you as a therapist don't feel prepared, there's resources out there to learn about elder abuse. Because I think whether you're a mandated reporter or just a caring person, we have an obligation to step up and step in for people that are vulnerable.
Just quickly, I mean, even as a mandated reporter, again, it's a complicated issue. It's a really complex issue about when you make that call and what is abuse and what will the authorities versus you see as abuse, you know. And that sometimes is a dilemma. What you know, because over the years, been doing this a really long time, I've seen a variety of things that you sometimes attempt to intervene, and the authorities really can't back up that, and then you lose all credibility. You know, it's a complicated issue, but we are responsible. We, as a clinician, I try to get involved in what is feeding that dynamic and the abuse. You know, sometimes the abuse is coming from both sides, so oftentimes we're talking a lot today about the caregiver, but the person who's ill is a big contributor to sometimes sort of the dynamic. And so I work a lot with the person, even with early dementias, because I often say, because sometimes they are really, I say to people who are depending on caregivers, if you were smart, you'd be really nice to your caregiver, because it's a dumb decision to be mean to them, because they got all the power in their hands. And that's always interesting too, because sometimes, again, people come in with a history, and sometimes, let's say the patient is in this case, say a male who is very controlling and domineering, and the wife had very little power. She suddenly is becoming the caregiver, and boy, does she start using her power, because it's the first time in her life she feels able to do that. And that can be a very, potentially sort of abusive situation. So in my work privately with patients, that is something that we attempt to work on from both perspectives, because we can't forget about the person who's also, sometimes the attention is all on the patient, and sometimes it's all on the caregiver, and their worlds are different, and their needs are often different. So it's important that we address them together and also separately, because both parties have a lot of needs that are not always the same in this kind of situation.
Okay, so are nursing homes instrumental in healthy aging, or are they understaffed? I don't know if that's a rhetorical question.
That's a very loaded question, too. Our volunteers serve all the nursing homes in the area, and they're student volunteers, and they go in and they find themselves in some pretty hairy situations. I think Atul Gawande's book, Being Mortal, speaks to that situation really well, because nursing homes are a medical solution to something that's not a medical problem. And so, I often find myself, the whole idea of first do no harm is sometimes violated a lot in nursing homes. And yet, in those nursing homes, you've got some really fine people trying to do good work. So you can't just tar everybody with the same brush. So we've always just tried to endeavor to support the best. And I think nursing home staff are notoriously poorly paid. They have to do a lot of lousy work. And so it's a matter of supporting the staff and giving them as much education and training and respect as possible. Sometimes we find that we're encouraging the residents there to be kinder to the staff for the same reason you just mentioned about the caregivers, and helping them all feel part of the team and developing the ability to communicate versus be in the servant relationship. But as we're all here together, we've got to figure out the best way to travel. So I liked your running analogy about running with others too in the marathon.
I think there's a wide range of facilities, and they're all different. So I would hate to put them in one category, because there's some incredible nursing homes are sort of, which are now skilled nursing facilities, they're really not as, we see a lot more of assisted living, continuing care communities, independent living. I mean, we see more of that than just nursing homes anymore. And the facilities that do assisted living, they are taking on more and more the kind of patients that used to only be in skilled nursing facilities. So it's a changing culture. I think they are trying. I work with a lot of them. I think some of them try more than others. I think the challenges you're talking about who they have to hire, the low pay rates. And I think it's only, in skilled nursing facilities that under the law they have to have like a social worker there. None of the other, I think at lower levels of care, they have no Is that right? That they have have to have like a mental health professional there. So, trying to find, for those of us to sort of find a way into those to provide some of those kinds of services, because they're not always available, and there's one person for a lot of patients. So there is a big difference today between skilled nursing and Medi-Cal facilities and private facilities and dementia care facilities. Now we have some great memory care facilities that are only memory care facilities in this community. There's some great options, but of course finances are definitely part of that, the ability to pay.
The one thing I also heard in this question that I think we all have to be cognizant of is the healthcare crisis in terms of the silver tsunami. There's more of us coming down the pike, and so are they understaffed? Likely, and finding qualified and enough caregivers around is something that as a country we are going to be facing. And the only other thing I want to say is, no matter where your loved one is, I found it also in hospitals, and I know you guys had it on your checklist, is the role of being an advocate for your loved one wherever they're placed, whether they're in the ER or they're in Cottage Hospital or they're in one of these other facilities. That is something that I feel that we all do as caregivers, is to make sure that our person is getting what they need. And the staff that I work with, even in visiting nurse and hospice care, are the most loving caregiving, but they're stretched. The caseloads go up, you have X amount of time, and the pressures of working in a Medicare system. I'll just say this, I heard a man speak about the healthcare system, and he said, well, it's not really about health, I'm not sure about the care, and it's certainly not a system. So that's what we're up against. So.
Again, at the Alzheimer's Association, we have some great information on what to actually look for when you do start looking for these residential facilities. And just as Joanne had said, that nursing homes are such a small percentage now of, I think, the bigger question, which was just residential living. That does include nursing, assisted living, memory care, and they call them bed and boards, 6 beds. Also in Santa Barbara, we have wonderful placement agencies that can actually talk to you, and they've been somewhat vetted, I believe very vetted by these placement specialists that can really get to know the personality of your loved one and help you make that decision. So good resources again.
And I think they're adapted. I just learned this resource the other day that Oak Cottage, which is a fabulous facility for memory care, is now offering respite for not just people with memory care, anyone who needs it, because of caregiver burnout, that it's a 4-week stay, 2 weeks are for free, and the last 2 weeks are $290 a day, which is pretty extraordinary. So, but you don't know about these things. I just happened to learn about them, and hopefully our hope is that we can all share these resources that we know about and incorporate it into your agencies, because I think they're hard to sometimes come up with because they keep changing. I mean, they keep offering new things that a lot of us don't even know about. So hopefully we can coordinate more on what we know to extend that resource information.
Yeah, and I just again want to say the Santa Barbara Foundation is doing really a pioneering job in bringing collaborative agencies with all these resources together in a very planful, systemic, thought-out way in which we can know more about each other and collaborate more fully together. Because, I mean, just sitting up here, look at all the richness of resources we have, and I'm sure all of you in the room have that to offer, and so we really owe a debt of gratitude to the Santa Barbara Foundation for moving that forward, and it's going to be really, really important and big for the nation, actually, as a model. So we're going to shift a little bit because we actually have a few prepared questions. We cheated in case you didn't have enough questions. And I'm going to ask them of you, but I also want to turn, to surprise you, the keynote presenters. Was there anything you wanted to add to this rich conversation that we've been having? Any thoughts that came up as we were talking?
I mean, first of all, I want to say I'm impressed with the range, the speakers we have up here, but also the range of services that Santa Barbara has, and maybe partly under the stewardship of Santa Barbara Foundation. So I think you guys consider yourselves fortunate. We have the privilege of going to lots of parts of the country, and there are lots of parts of the country are not nearly as well resourced as you seem to be. So, so that's a good thing that you guys have these things. In particular, in regards to the nursing home question, what I would say, just along the lines of what you said, Joanne, well, I think the definitions of these terms is shifting. What used to be called, what is assisted living now? What is really the definition of it? I mean, there are federal definitions, and there are funding streams, or actually lack of funding streams for assisted living. But I think that with any of these residential facilities, the question becomes what is the best fit for your loved one? And my own personal experience, having in the last 7 years dealt very closely with 2 nursing homes. One, what I considered to be a hellhole for my stepfather, another one which I considered to be a wonderful place for my mother. I mean, there's just a range of experiences, and I think you have to do your homework. And as you also said, you have to advocate wherever your loved one is. So that's the only thing I wanted to add.
Okay, thank you. Lisa.
Can I just add that Family Service Agency operates the long-term care ombudsman program? We do have quite a, thank you. We have a number of staff and volunteers. We do monitor the care of residents in long-term care facilities, and we do have quite in-depth knowledge about every facility, including the 6 beds. So if you need some help trying to figure out a good fit for your loved one, call Family Service Agency. We can help. I also just want to put a plug in, if you don't know, that October 3rd is the Senior Expo at Earl Warren Showground. I think it's open from 8:30 to noon. And if you have never been there and you are a caregiver or a professional, that is the place to go to see all the resources that are in this community. There's free literature, there's flu shots. It happens once a year, and it's coming October 3rd. So it is a great place. And Jeannie West? So there will be flyers at the table, because Miss West, if you don't know her, will magically whip them up, as she always does. But I mean, it's really important, and I understand when you're overwhelmed, it's hard to even get out. But if you're a caregiver or you know a caregiver, get them to the Senior Expo. You don't need to be there for 4 hours. The walkthrough, there's hundreds of resources, and there's people you can ask those questions to, and I think it's one of the gifts that we give this community every year. So October 3rd at Earl Warren, if you don't know.
Thank you. That's great. See, this more information just keeps coming out. So what I'd like to do now is I'm just going to go down the line in this order and ask one of the questions that we had prepared of each one of you. So Simon Fox, first you. Would you talk with us about what do resilient caregivers have going for them that others don't?
Let me reframe compassion for a second here. Because what resilient caregivers don't do is that they don't get stuck in doing for. We tend to think of compassion as giving to people who don't have, right? Or doing for people who can't do it for themselves. And there's a third kind of compassion that is probably closest to the essence of the real root of the word, the Latin root of the word, compati. And that is being with. So sometimes we get in these positions where you can't do anymore, right? You're out of energy, or you don't have the expertise or the resources or something, and that's when you'll see health professionals. They'll throw up their hands and go, "There's nothing more we can do." Well, that's not true. It might be there's nothing more they can do medically, but there's still a human being there, and this essence of this ability to be with someone who's suffering, that's the real essence of compassion, and find that ability to connect with them through that struggle. You can't do it for them, but you can be with them. And there's a very big difference between facing something really tough alone or feeling isolated, even if you're in a room full of people, and one person who's made that effort to cross that bridge and find out what is it like in your world. And that's that art of being connected. So it's not just doing for people, it's our ability to be with them during this tough stuff. So what we've found is resilient caregivers, they can do this. And we call them the ABCs of resilience, which is they have they have an awareness, a self-awareness, so they can monitor what's going on with another person, but also at the very same time be monitoring what's going on with them. You know, so you're aware of how is your energy level? Are you centered? Are you not centered? And you know, oh, is now a good time to make a decision, or maybe not? Put it on hold. And then there's the balance, the sense of ebb and flow to life, and that this too shall pass. And because all of life breathes. So there's always an ebb and flow, there's tides to everything. And if we get into machine-like thinking, we forget that. And we think we can just go on forever and ever and ever, not realizing that, in other words, life is not sustainable. Caregiving is not sustainable without balance. There's always a give and take and an ebb and flow. So allow for that. And then the third, the A, that's the A, the B, and the C is connections. Stuff to hold, people, things, precious things to hold on to that keep you true to who you are. The reference points in life that are time-tested, the people who will always be there for you, the philosophy that will always be there for you, the great examples that will always be there for you. That's the kind of stuff. So you don't get swept away. You've got things to hold on to. So.
Thank you. Kendra, do you have any tips for creating a safe living environment for someone with dementia or other cognitive impairments?
I do, as a matter of fact. And this is a topic that's really important to me, is safety. And if you think about it, that's usually how someone gets into a caregiving role, is you're starting to notice that your loved one isn't safe in some way. And it could be that their driving has become erratic or scarier. I've had some family members with that come up. It could be that they're not leaving the home because they don't feel safe going out, or they're getting lost. It could be that that person isn't able to bathe on their own anymore. It could be that they're not taking their medication. So there's a lot of ways that we end up getting involved in someone's life, and it often has to do with their own safety. And so the first thing I wanted to throw out is to not be afraid to make some of those tough decisions on behalf of someone who may have impaired judgment about their own safety. I've met a number of caregivers who, and I think of my own parents. My mom doesn't drive, my dad drives. And so I've started to have conversations with them, like, what's gonna happen when dad can't drive? You know, and they'll say, oh, I hope it doesn't come to that. Well, if it does, you know, so that we're not dealing with it in the moment, you know, that my dad, God forbid, has something happen where he can't drive. Let's start that conversation now. But I'm not afraid to make those tough decisions and to get them the resources they might need when he isn't able to provide transportation. I've worked with caregivers who haven't wanted to make the report to the DMV so that they can come and do the test and they can determine whether or not someone still qualifies for a license. So there's that aspect. There's a lot of really cool tools out there that caregivers can get for safety. One of the neatest resources I've ever seen is called the AlzheimerStore.com. They have a lot of devices. One of them can disable a car. It's just a little device that you can put inside. It's not noticeable, but my gosh, it doesn't turn over when they put the keys in there. There are devices to change the lighting, because as the disease progresses through the brain, your awareness of lighting and shadow changes, and so someone may be afraid to step off of a bus because they feel like they're stepping into a hole, or they're afraid to step into a shower or over a bathtub because it's dark and they feel like they're going to fall. So there's ways to look at the lighting in your home to make that person feel safer. There's ways to paint the walls in your home if someone has memory impairments and like can't find the bathroom. There are ways to, tastefully redo your home environment so that you can aid that person who has a memory impairment. And then there are a lot of, my staff are going to laugh, I'm kind of a techie geek. There's a lot of apps out there that can help you with emergency response systems and GPS devices for someone who wanders. The Alzheimer's Association Wanderers program, getting someone enrolled in that so that if they do get lost, someone can see they have that bracelet or pendant on and help them get to where they need to be. So kind of those nuts and bolts aspects of caregiving, a lot of them have to do with safety, and our family consultants and therapists at the Coast Caregiver Resource Center spend a lot of time talking about safety and how to keep someone safe. So I think there's a lot of neat and creative ways to do that that also help someone maintain their dignity, which I think is of highest importance. So.
Thank you. So Arlene, I'm going to ask you a question that didn't come up a whole lot here, which is about volunteer involvement in the caregiver situation. And I want to add, perhaps if you can talk, professional caregiver, family caregiver, volunteers, how does it all work?
Thanks for that. The first thing before I get there, I want to say this one piece, because I think it's the misunderstanding about when hospice is appropriate, medical hospice. What I see and Hospice at Santa Barbara is open to anybody at any time, no cost, free services. I work for visiting nurse and hospice care, and at that point you need a doctor's referral when your prognosis is 6 months or less. What I see all too often and what people think is hospice is when you're at death's doorstep and you wait and you get on hospice when you have 3 days left or 5 days left, and there's not a whole lot we can do for you. So I just want to talk to you about, don't wait. If your loved one is appropriate for hospice services, talk to your doctor, get enrolled, and you will get additional support. You will get professional help, a nurse, a social worker, a home health aide who can come in, not 24/7, but will take some of the burden off. I work with volunteers, and Medicare requires that all Medicare hospices have trained volunteers who do support caregivers. And the role that our volunteers play as members of the team is to provide respite for caregivers. They don't do medical things, but they do stay and they provide companionship and time off for you, the caregiver, so you can go to read that chapter, go for the walk, or that type of thing. And we have an extensive training program for volunteers. I also want to say that people think hospice, while it's available 24/7, my loved one has a pain breakthrough at 2 a.m., what do I do? The nurse will come out. It doesn't mean you have 24/7 people in your home all the time. And that's where professional caregivers come in, and they are usually an additional cost. Visiting nurse and hospice care has a professional care service that anybody can purchase a 4-hour time block, I believe it is, to give yourself a break. And so having professional caregivers is important to spell you, especially when you're in for the long haul. And because you're on hospice does not mean that your loved one's necessarily going to be gone in 6 months. As long as they're medically eligible, they can stay on those services, which is also a misunderstanding about hospice. I can tell you, I've seen hospice patients on our services for 2+ years or more. So it's important to understand that. So if you are called to do this work, and I would say caregiving is a calling, hospice caregiving is another whole level of calling. And if that speaks to you, we do train people extensively. And what we found with our volunteers is they turn around and use that training when their own loved ones also have that need. So there's flyers out. We're doing a training in the fall. Don't wait. And the one last thing I would say is start preparing now with your loved ones. If you don't have an advanced care directive with your family member now, if they're fine and you don't have that piece in place, when the crisis hits, you're going to put yourself in overwhelm. So part of the reason to not is to start having those conversations and start doing the planning now before the crisis hits. Thanks.
Thank you. Marcy, I'm going to ask you, what is the relationship between cognitive impairment and difficult behaviors, and what can a caregiver do to manage that?
So when somebody, let's start this way. Oftentimes when I have clients come in and talk to me, they start off by saying, my mom is stubborn, or my mom's in denial. She just refuses to accept that she has cognitive impairment. So the first thing really quickly is to note that cognitive impairment enables a person to think and reason like we do. So there's an acronym that we talk about at the association. It's called DARE, Do Not Argue, Reason, or Explain. So what you need to remember is that their brain is not firing up. It's not only their memory, but it's their language, their judgment, their reasoning, their abstract thought, meaning what's not there, they can't see. So when all of these things start happening, bringing them into your world is not going to be helpful. You need to visit them where they are. And this brings into person-centered care and to our keynote speaker's discussion about family dynamics. Not only do you want to realize or figure out the care part, and I found the word actually, it's care partner, not caregiver. That helps quite a bit. It does help quite a bit. But you want to know who the person is and who they were and what their likes and dislikes were. Because if you don't know this and you asked my mom to play bingo, she never liked bingo. She's never gonna like bingo. You put on disco music and she will dance. So you really want to understand that. So that's the first part of it. So what you can do is try and figure out who they are. Remember that all behavior is a form of communication. When somebody is cognitively impaired, they cannot use the language any longer. So their behavior, repeated questions, maybe you shouldn't tell them their information too far in advance because they know they have to remember something, so they keep asking, when is she coming? When is she coming? When is she coming? Maybe like a few minutes before the person arrives, you let them know that that person's coming. These types of things can really, really help. And again, at our association, we have a lot of information on this and how this can work for you.
Thank you. Joanne, I want to ask you, in your practice over all these years and working with so many caregivers and people at the end of life, what do you see as the complexities, and what are the common complexities of the interrelationships? This is like a year's course, I know, but if you could give us some of the highlights of how you see that and how you manage it as a practitioner.
Well, I think
Yeah, hold on.
I think what Simon maybe said is again, it is so enormous. We're covering the entirety of people's lives, all the things you're saying, the personality, and you said something before about, the step at a time, the little, setting really small goals. I use a lot of metaphors in my work, and so I tell people, I once attempted to learn how to ski when my kids were little. I was never very good, but something a ski instructor once said to me that made so much sense to me is he said, don't look to the bottom of the mountain, just ski 5 feet in front of you. And you go 5 feet and then 5 feet and 5 feet, and eventually you're down at the bottom of the mountain. And so, I think even in the work, people come in and they spew a million things, and I generally say, at the end of the day, it's going to come down to maybe 4 or 5 things. And when you can help them sort of categorize them, make them workable entities so they don't feel so overwhelmed. Because when we're overwhelmed, we can't do anything. We become immobilized. So I think in a lot of the work, I think it's also, people have all kinds of expectations throughout life, at death, in caregiving. I think we have to help people renegotiate expectations, what's reasonable and what's really probably not reasonable. So there's a lot of things that we can do in working with the system. So those would be a couple of things that come to mind. It's a huge topic, so it's the best I can do right now.
That's great. And also you have a brain boot camp.
I
thing
do.
just
And that's been really, because I think what happens too when people are working, especially in the area of dementia, how frightening that experience is, actually both for the person with early cognitive impairment, dementia, and I'm fortunate enough in my practice that I've seen people over long periods of time that I get to see them early on as their memory starts to slip. I'm able to identify, I can work with them early, get them sort of in the right direction. But it also, when you're taking care of someone with dementia, and I've seen it in my own family, you start to wonder about your own, the fears, your own fears about your own death, your own mental health, your own cognitive impairments start to really get stirred up. So one of the things, because I've watched an aging population in my practice, and it comes up probably starting late 50s, 60s, 70s, 80s, it keeps this issue being afraid of what's happening to our memory. And so, empowering people in any parts of this work is really important. So I've done a bit of work with UCLA. I've referred a lot of my clients to their longevity center, especially for neuropsychological testing. And they have some great programs. One of them is called Brain Boot Camp. And they asked me and licensed me to bring that here to Santa Barbara to work with basically the normal aging population and help us work on increasing our brain plasticity. We now know that our brain cells can continue to regenerate if we look at working on some brain exercises, nutrition, stress reduction, exercise. There are a few things that we still can do to help in that process. So one of the privileges I have is bringing that program, it's a 3-hour program, to Santa Barbara and be able to provide that. I've actually done it also with a group with people with MCI, mild cognitive impairment, which was great for them to feel like they didn't have to just give up and wait for the dementia to happen. MCI doesn't always evolve into dementia, but that's the fear that they live with all the time. So I've done this group with people with MCI, as well as a lot of people who are just like you and I, aging. And because all of us walk into a room and say, what was I coming in here for? Or, losing the keys, or spending, I have a tile on my phone and in my organizer, because if I lose those, I'm in trouble. So there are things that, because this is normal aging, and helping people differentiate between what is pathological brain changes and just normal aging changes. So, lots of things get kicked up as we're doing this work, working with an older population, for us as professionals, as caregivers, as family members.
Yeah, and also the complexity of boomer age people caring for their parents and some cognitive decline in both parties. Yeah. Yeah, so I'm going to remember to thank everybody here, and especially our panelists. You are volunteers here today, and I really appreciate your sharing the wealth of information you've shared with us today. I really appreciate it. And to our keynotes. To Barry and Julie, thank you so much for a wonderful presentation. To Santa Barbara Foundation for helping to make this happen. Santa Barbara City College for hosting us. Thank you. It was a beautiful, beautiful venue. And Family Service Agency for being such a wonderful partner and provider to the community. And to all of you for all the work you do. And please tell your friends and family and colleagues that you can come to Santa Maria tomorrow, and we start sharply at 9 there as well. So I'll see you all in the community. Thank you.